your working group was about finding solutions and looking at practical solutions in daily care. So it would be great if we can go with your presentation and you can give us some insights.
Thank you, Christophe. Thank you, William and Darren. I think that we must say that in a year we really changed our life and we reorganized our health system and created efficient vaccinations. But the price we paid to cope with this emergency was very high, and it's not said that this situation will not be repeated. And so we have to prepare for this not happening again. We cannot remain passive in front of the inadequacy of the political and organizational system we have lived, because in the past year we assisted to the interruption of cardiovascular care. In a desperate attempt to cope with the COVID emergency, and the patients even stopped seeking for help. What didn't happen with other specialties, like in oncology, for example. So this underlines the ignorance of both the medical system and patients about the inherent risk of the cardiovascular disease. So very practically, as cardiologists, we have to fight to keep our COVID-free division destination. It will be difficult sometimes, but it's a must, because if the division gets infected, we stop working. We need to provide safe services for emergency treatments like primary PCI and pacemaker implantation, and to test all the patients to keep clean. And if a patient is infected, should be transferred to a dedicated area. Starting from the emergency room, dividing the emergency room for infective and non-infective patients, and then in the ward, keeping the patients separate in isolated rooms and avoiding any kind of unnecessary emergency examinations. Even an X-ray may be dangerous for the patient going to the radiology department and coming back with the infection. So the other point is also very important, to create a list of priorities. Those patients that cannot be delayed are patients admitted to the emergency room, those with symptomatic coronary artery disease at rest or minimal effort, those in waiting list for TAVI being very symptomatic, and those needing cardiac stimulation. Then we will think about other indications that these 4 diseases cannot be denied for patients. And of course, if you don't have an option in surgery, try to shift conventional surgical indications on the endovascular options, which might be life-saving. Very important is to activate a program of remote consultations, a toll-free number, a telephone for patients seeking for help, and a Zoom link for these extra hospital colleagues that need for an advice for the patients that cannot be sent to the hospital. And last but not least, mass media is important. You as a clinician should reassure people, telling which is the state of your division. If you can serve your patients safely, and they will trust in you and they will keep on coming to your hospital. You have to appear in the mass media communication together, supported by your scientific societies, to issue general appeals and press releases.